Great pleasure to introduce you to Dr. Mili Roy. I've heard her speak, and I think you will find uh, her talk tonight very interesting and persuasive. So, Dr. Mili Roy is a physician surgeon in the Greater Toronto Area, involved in clinical practice, teaching, and research, and is an assistant professor at the Faculty of Medicine at the University of Toronto. She serves as Ontario Regional Co-Chair for CAPE, C-A-P-E, which is the Canadian Association of Physicians for the Environment. And she's also co-chair of OCEC, the Ontario Climate Emergency Campaign, which is a multi-sector environmental democracy coalition now representing over 850,000 Ontarians. As a mother and physician, she has been advocating increasingly in the planetary health space as the need to act has become more urgent. Dr. Roy has been a practicing ophthalmologist for 25 years and is passionate about environmental and sustainability issues, as you'll see in her talk tonight, which is called Climate Change, Air Pollution, and Your Health, a Perfect Storm. Welcome, Mili.
Thanks very much, Jill. And I'll just take a moment to share my screen, make sure everyone can see my slides. And there we go. Is that okay? Everyone can see the screen? Okay. Well, thank you for that lovely introduction, Jill. And it's such a pleasure to speak to you all today at CFUW. I have spoken to one of your other chapters before, as Jill mentioned, and had a wonderful time meeting the group and speaking to everybody. I will move right along as Jill has already done the introduction and just give you a little bit of an outline. The talk today is so aptly timed. As we enter 2024, we are leaving behind the hottest year in recorded human history, which triggered the worst wildfires in Canadian history. So very good timing to be thinking about these issues around climate. So we'll talk a little bit about just a bit of introduction, and then I'll dive right into the health impacts of climate change, of air pollution, and then we'll talk about some of the good news and the solutions that, that are coming through all of the bad news, and what we can all do together to push forward on these solutions, and then leave some time for question and answer afterwards, as I would love to speak to you and have a little bit of a discussion. Just a little bit about CAPE. As you already heard, I am affiliated with CAPE, and we are a group of physicians, health professionals, but also community supporters. You don't have to be a health professional to be a part of CAPE, and we're working in the intersectional space of planetary health to improve human health by protecting the planet through evidence-based ethical actions. We engage with governments, run campaigns, conduct research, do education, and we draw media attention to key issues. And we also collaborate with other organizations, both nationally and internationally, to work and build power together. Speaking of planetary health, this is based on the notion that a healthy planet and healthy people are two sides of the same coin. So you cannot have one without the other. And you see this reflected in this quote from the executive director of the World Health Organization. Similarly, health harms due to the environment are also, in a sense, two sides of the same coin, two interconnected pathways that are largely driven by fossil fuels. One pathway is carbon pollution, which drives global heating and climate change, and the other pathway is air pollution, which generates particulate matter and toxic gases, which harm our health. And together, these pathways sort of interconnect, amplify each other, and produce what I call the perfect storm of health harms. So let's dive right in by looking at the climate crisis first and its impacts on our health. We need to understand where the climate crisis originates. We know, of course, that the largest source of global warming comes from the burning of fossil fuels, and you see the exponential rise, over the decades and centuries here. Just for a little bit of context, though, we can actually trace over 70% of all GHG emissions or greenhouse gas emissions since 1988, the year that climate change was actually coined, to only 100 active producers. Or looked at another way, just a little over the majority of all greenhouse gases since the Industrial Revolution were produced by these same 100 producers. And we're talking about giants like ExxonMobil, British Petroleum, Chevron, Shell, and so on. In 2022, the coal, oil, and gas sectors globally received subsidies of 13 million US dollars per minute. That's around the clock, every day of the year. And Canada in particular provided more oil and gas subsidies than any other G20 nation until a very recent commitment to cut what they call inefficient fossil fuel subsidies. And that was a promise that was kept after many years back when it was first made, and we'll see what the outcomes are. Now, not all greenhouse gases are the same. Let's take a moment to look at the difference between carbon dioxide and methane. Carbon dioxide accounts for about 70% of global warming since pre-industrial times, while methane accounts for about 30%. But we've been learning more and more about methane recently. In fact, it turns out methane is 80 or even 85 times more potent than carbon dioxide as a greenhouse gas. But while carbon dioxide will stay in our atmosphere for hundreds to thousands of years, methane only lasts about 10 years. So when we're looking at strategies to improve our health by improving on the climate crisis, there's a lot of rationale to aim for reducing methane because the short-term potential to reverse climate change is a lot stronger. And if we try to understand where the methane is coming from, a large source is agriculture, so about 1/3 comes from livestock, for instance. But right here in Ontario, you'll be hearing a lot about our energy grid and our government trying to ramp up gas-fired electricity. And it's important to understand that gas, which is called by the industry natural gas, but we like to call it fossil gas, is actually methane. So it's really important to understand all of these and how it connects with our health. And just to give you a little bit of some of the newest research as well, it is now turning out that liquefied natural gas, LNG, which is produced by supercooling fossil gas, and this is done in order to fuel ships and also to carry this product by ship to countries for export. The inherent leaks release hyperconcentrated methane, and the total greenhouse gas emissions, in fact, are anywhere from 24 to 274% higher than coal, which until recently was felt to be the dirtiest fuel on the planet. And this is emerging research. In fact, it's still sort of pending peer review, but coming out of a very well-recognized research lab in Cornell. If we look at Canada's sources of emissions, no surprise, the oil and gas sector is at the top, followed by transportation, our built infrastructure, industry, agriculture, and electricity. Being from Cape, I like to also highlight that the healthcare sector, we contribute almost 5% of Canada's national emissions, and we are actively aiming to decarbonize healthcare delivery. And if we look at Ontario, the top or most of the emissions come from transportation, followed by heavy industry, followed by our built infrastructure. So now that we understand a little bit about where climate change is coming from, what are the impacts on our health? So climate change is now recognized as the single greatest threat to health in the 21st century. And this poster from the Canadian Medical Association attempts to lay out some of the many impacts that we're feeling across Canada. And this ranges, for instance, from illness, injury and death from extreme weather events to simple heat-related death and illness. So in fact, the 2021 BC heat dome was the single deadliest weather event in Canadian history, with over 800 deaths. And we understand now some of the latest figures show us that nearly 40% of all heat-related deaths across the world are related to human-induced climate change. And this is evident on every continent. And it is projected that we might expect 250,000 extra deaths every year, starting from 2030 to about 2050 due to climate change. So how does, for instance, pure heat cause illness and death? We can start with simple things like heat rash. I mean, we probably all have experienced that at some point or another, but it can progress to things like heat stress, heat stroke, heat edema, which is a form of fluid sort of imbalance in the body, dehydration, kidney issues, and it can trigger acute heart diseases. So people with heart disease need to take special precautions on those extra hot days. And this can progress to death, as we already talked about in the BC heat dome. There was a similar extreme heat wave in Quebec just a few years earlier that killed almost 100 people. And there are issues of equity as well that we can maybe discuss later on. Heat also causes agricultural stress, and this, of course, also ultimately impacts on our health. Now, where there is heat, there is also fire. And this graph here sort of shows the rationale and work that has been done to show the correlation between heat and fire. It's not just careless campers, as you know, certain provincial premiers might have us believe. So the story with the BC heat dome did not end with the deaths that occurred primarily in urban centers like Vancouver. The very next day, the entire village of Lytton, BC, which was primarily Indigenous, burnt to the ground with the hottest ever recorded temperature in Canada, which reached nearly 50 degrees Celsius. The most famous wildfire, of course, remains Fort McMurray from 2016. But just to give a little bit of a timeline here, in the same year that BC experienced its heat waves, right here in Ontario, we had our worst provincial wildfire season in recorded history. And then, of course, this past year in 2023, we had the worst national wildfire season in recorded history. So we are breaking a lot of records lately. So what are the health impacts of these wildfires? Across the world, and again, because this is an emerging and rapidly evolving situation, statistics are difficult to keep up to date. But we feel there's at least over 33,000 deaths per year around the world simply related to wildfire and simply related to the pollution produced by these wildfires. And smoke inhalation and poor air quality can trigger a lot of illnesses as well, things such as asthma, chronic obstructive lung disease, emphysema, and also heart diseases as well. It's also been proven to increase susceptibility to COVID infection. And there's an entirely new emerging field in health called pyroaerobiology, which refers to the fact that we now understand that there can be microbes, so living pathogens actually present within wildfire smoke, which we inhale and can cause disease as well. And some of this early work came out of California with Rift Valley fever documented in the California wildfires. Now, moving on to other impacts of the climate crisis on our health, by deepening, it deepens housing and food insecurity, which are both social determinants of health. Planetary warming decreases crop yields across the planet, and of course, extreme weather is directly damaging agriculture and housing, and again, this is impacting on our health. Of great concern in the medical community is the change in infectious disease patterns. So you see here in this little animation a number of different diseases that are proliferating in all parts of the world, and including right here in North America. So climate change, some of our latest research is showing, may aggravate nearly 60% of all human pathogenic diseases. And also of huge concern in the medical community is that we are seeing an increase in antibiotic resistance due to climate change. Now, if we focus in on Canada, and in fact, on Ontario, Health Canada data is showing us that risks of multiple infectious diseases, such as Lyme disease, West Nile, and just the overall risk of pandemics, such as COVID, have already increased. And the Canadian Public Health Association warns that Ontario may be at risk for things like malaria, yellow fever, Zika, dengue fever, and more in the near future. These are things we've never seen in these areas before. And I want to wrap up the impacts of climate change on health by speaking about mental health impacts, which are absolutely devastating, particularly because this disproportionately affects our youth. A lot of this work actually came out of Canada as well. There was an excellent study done after the Fort McMurray fires, looking at high school students who had been in the community at that time. And there was a clear link found with increases in depression, addictions, suicide, also things like low self-esteem, low resilience, and so on. And another global study, the largest of its kind, looked at 10,000 youth around the world. And we find that nearly half, 45%, are experiencing climate anxiety that affect their daily life and functioning. 40% are hesitant to have children of their own because of climate change. And more than half, 60%, believe that governments are betraying them and future generations. And that's a statistic I often highlight in red when I'm presenting to government or lobbying government. So if that weren't enough, we have a whole nother set of health impacts due to air pollution. So let's take a look at that. Now, first of all, what is air pollution? So let's just understand a little bit about it. There are many, many different definitions. I've chosen just to share the one from the World Health Organization, which basically tells us that air pollution is a form of contamination of the indoor or outdoor environment by any chemical, physical, or biological agent, which changes the natural characteristics of that atmosphere, of the air that we breathe. So essentially, when we talk about air pollution in health, we're thinking about four major components. And these are, again, all defined by the WHO. This is often what's being measured with air quality indices and so on. And that includes particulate matter, ozone. And when we're talking about ozone here, it's not atmospheric ozone up in the sky. This is something called ground level ozone. And we're talking about nitrogen dioxides and sulfur dioxides. And I'll just go into a little bit more detail about particulate matter because this is one of the most important components. It's often called the proxy indicator for air pollution. We can subdivide that into a few types. The largest type, which is called PM10s, maximum size of 10 microns, when we breathe these in, they can penetrate and lodge deep in our lungs and tend to be linked with lung diseases. But even more importantly are the PM 2.5s, maximum size 2.5 microns. When we breathe these in, they go right across the blood-lung barrier, pass through our lungs into our bloodstream, and then can have major impacts in multiple systems of the body, as we're going to talk about in just a moment. And then just for completeness, there is an ultrafine particulate matter PM1s. These are not as often measured and studied. And I just wanted to mention as well nitrogen dioxides, because this is the other component that is most impactful on health, and also because these, when they're aerosolized, form part of the particulate matter, and they also form the ground level ozone when they're hit by ultraviolet light from the sun. So often on sunny days, we see the highest level of ozone pollution. And these are produced by combustion, whether it's for heating, power generation, vehicles, and so on. Okay, and furthermore, just to understand air pollution, we think about air pollution as ambient or outdoor pollution versus indoor pollution. Ambient pollution is usually generated from transportation, generating energy, manufacturing and industry, and increasingly by wildfires as well. While indoor pollution comes from sources like indoor our gas stoves and smoking in Canada. In more developing nations, it can also come from indoor lighting, heating, and cooking when it is done with fossil fuels indoors. And just a little primer on how to interpret the air quality indices or the reports that we would see in our everyday weather reports right here in Canada. The system that we use to measure air quality is a little bit quite different actually than what we would see in the US. So our system is based on a simple 1 to 10 health risk scale, which you see laid out here. And I've showed in the next slide. Just a sort of a typical, I picked a day from last summer when, on certain days we were experiencing wildfires that made our risks worse. And that day in May happened to be a 4 on the AQI index. And what we see is recommendations based on that score for at-risk populations versus general populations, helping people to understand, how they might want to restrict their activities depending on the air quality on that day. And at-risk populations would include children, the elderly, pregnant women, people with lung disease, heart disease, and so on. Now, I wanted to give a little bit of local context here as well. Ontario's coal phase-out, which was completed in 2014, was the single largest emissions reduction ever achieved in North America. And smog days were virtually eliminated. 53 days as an average, say in 2005, and then in the 5 years after phase-out, there was only one single day where there was appreciable smog, which of course is a huge health harm. And it's important to know that the pollutants that are generated from gas-fired electricity, which again, our government is trying to proliferate at the moment, are the same ones which are found in smog. So gas-fired electricity expansion would risk reversing much of the huge and hard-won gains that we had in Ontario by getting off coal. Now, again, for sort of a larger context, how big is the problem of air pollution now that we understand it a bit better? Globally, nearly 7 million people die prematurely every year due to air pollution. That translates to over 15,000 Canadians and nearly 7,000 Ontarians dying prematurely every year. And these are slightly outdated statistics. Compared with, say, other major health risks across the planet, you can see pollution in red there. Stacks up very high. It's equal to smoking and secondhand smoking, much larger of a risk than things like malnutrition or substance abuse on a global context. And in fact, we find that about 1 in 5 premature deaths across the planet are linked to breathing polluted air. Now, let's look at how our health is impacting. How does all this death and illness occur by breathing polluted air? I just wanted to start by highlighting actually an excellent report that was put out by CAPE in 2022, and I've included the URL so you can. It's open access if you ever wish to do more research or learn more or use it as a resource. This report was synthesized from nearly 1,200 research articles from across the world, so it's a really comprehensive view, which reports on the health impacts of air pollution, as well as epidemiology, equity, and also gives evidence-based recommendations for public health. So just starting with this little pictograph here, we can see that the health harms of air pollution go far beyond just the lungs, as we often hear in the media and is often the general perception. But let's start with the lungs, since this is the portal of entry. In terms of lung disease, breathing polluted air can not only worsen or trigger, but in fact, it has been shown to cause asthma, especially in children. It can worsen chronic obstructive lung disease, emphysema, and bronchitis. It definitely has it increases risks for cardiovascular or heart disease, so things like heart attacks, arrhythmias or irregular heartbeats, high blood pressure, and blood clots. Studies have shown that hospital admissions for heart disease spike higher on days when sulfur dioxide levels are higher. So there's a tight correlation. And recent research, for instance, is showing that taking healthy adolescents, so teenagers, and having them breathe polluted air within 2 hours starts to produce irregular heartbeats in these otherwise healthy kids. Let's look at other impacts in terms of the brain. Um, Air pollution increases the risk of stroke, dementia, Parkinson's disease, ADHD, and neurodegenerative diseases like amyotrophic lateral sclerosis. And we're finding with very well done research, meta-analyses, that even a small increase in pollution raises the risk for dementia, for example. Moving on, the endocrine system. Breathing polluted air increases the risk of diabetes and obesity. And these are not just simple correlations with, for instance, reduced activity or exercise. This is because the pollutants actually alter our cellular functioning, the way we handle fatty acids, the way we metabolize, and even produce insulin in our bodies and so on. So very, very deep-seated effects. Air pollution is linked to multiple forms of cancer. The strongest links are with lung, leukemia, and breast cancer, but there are other links as well. And it is a definite risk to pregnant women and babies. It is strongly linked with low birth weight, premature birth, stillbirths, and birth defects. And again, we find that there is a correlation with mental health impacts independent of climate change. So again, even with very rigorous systematic reviews, meta-analyses, we find there are clear links between breathing polluted air and depression and suicide, as well as links with things such as anxiety and stress. We also know that, as I mentioned a little bit earlier, that air pollution increases the risk of COVID infection, as well as transmission and the risk of death. And it's felt that the air pollution particles almost act like a transport vector where the virus, the COVID virus, sort of hitches a ride with particulate matter down into the lungs. And those same lungs, if they've been breathing chronically polluted air, tend to have chronic inflammation, which makes those lungs more susceptible to becoming infected. So there's multiple mechanisms going on there. And very recent research is showing that air pollution is also increasing antibiotic resistance. So again, this is independent of climate change. And in fact, we've even worked out, it's felt that every 10% rise in particulate matter may increase antibiotic resistance by about 1%. And there are projections that by 2050, this could lead to nearly, a million, so 840,000 premature deaths every year unless we curb air pollution. So again, there are so many direct links here with our health. And equity is a big factor running through all of these impacts. In today's world, about 99% of the population breathes polluted air. But if we look at the impacts, about 4 million deaths occur every year from outdoor air pollution. And 91% of this mortality, of these deaths, is occurring in low and middle income countries. If we look at a list of the world's most polluted countries, so this is a list where being number one means you are the most polluted country. Bangladesh, Chad, Pakistan, lead the list. And just for context, I put Canada in there as well. Of 118 countries, we ranked 95. So we could do better, but we're certainly so much better off than so many countries in the world. But even right here in Canada, there are clearly equity issues when it comes to air pollution exposure and health impacts. So research has definitely shown that lower socioeconomic status in Canada is linked to higher air pollution exposure, higher health risks, and greater barriers to healthcare access. The American literature furthermore shows that there are similar trends for racialized persons, but we don't have that research done yet in a Canadian context. We also know that, again, in Canada, increased levels of traffic-related air pollution occur within about 500 meters of major roads. And if we look at our population across the country, in fact, 1 in 3 Canadians lives even closer within 250 meters of major roads. So many of us are at risk, for this kind of exposure, but even more so with lower socioeconomic status. So that was a lot of heavy information, and a lot of these sort of negative and adverse effects and impacts that we need to know about in order to do better. So let's look at progress in climate solutions and advocacy and some of the good news. So we want to look at it in this talk being about our health. We need to understand that addressing climate change by reducing emissions actually prevents the worsening of health conditions around the world. And this is something now that I present to a lot of, in a lot of talks to other health professionals in trying to make the case for why more health professionals need to get involved in this arena of advocacy. So let's look at some of the options that would make our world a better place in terms of emissions. So globally, wind energy could supply our global needs 40 times over. So let's see what's been happening in reality. Back in 2000, based on the projections we had by the year 2010, by the time we reached 2019, we had exceeded our predictions by a factor of 22 times in terms of the wind capacity generated. When it comes to solar energy, 1 hour of solar energy can actually power our entire planet for a whole year if we were to capture it all and use it efficiently. And let's see how we've done so far. So back in the early 2000s, our projections for the year, say 2010 in solar energy, we beat it by 17 times. By the year 2019, we had exceeded projections by 121 times. And what this shows is the exponential growth of this kind of energy, which are the solutions that we need. I wanted to present something a little bit newer. This is information from the IEA, the International Energy Agency, their latest 2023 report that was just published. And what we find, what they projected was basically 2023 being the largest ever increase in global renewable growth, and projecting a similar growth going forward in 2024. China is currently the global leader in renewables. The US is certainly making some early strides with the current administration in power, but they have yet to ramp up to the capacity that China has. And the projections are that global fossil fuel demand will likely peak before 2030. And this graph shows, for instance, the growth in renewables, where global energy was generated by renewables at a percentage of 18% back in 2007 and grew to 30% in 2022. Now, one of the things I like to talk about is that very quietly, while we were busy with the pandemic in 2020, something incredible happened as well that got very little attention. And that is that for the first time in history, renewable energy became the cheapest source, became cheaper than fossil fuels. And in fact, solar energy became the cheapest global source of energy of electricity in history. And prior to that, it had been coal. And this is actually a game changer when it comes to making our case, to get off fossil fuels and basically, implement these public health actions that we need, because the economics are finally in our favor as well. Now, I wanted to present just a few sort of environmental solutions that have happened in the last little while. Of course, there's too many to choose from, so this is, I guess, a fairly random list. But just if we cast back over the last couple of years, we have had some major advances. In 2021, a global methane pledge was signed by 111 countries, and this was a historic first-time pledge to reduce methane by 30% by the year 2030. And we've talked already about the disproportionate impact this can have compared with carbon dioxide reduction. In the first half of 2022, global electricity demands were met entirely by the growth of renewable energy. There was no fossil fuels in the mix during that time period. In 2022, the UN brokered the Global Plastic Pollution Treaty. And it's important to understand that as a petroleum byproduct, reducing plastics not only is good for for sort of land-based pollution, but in fact reduces our dependence on fossil fuels or use of fossil fuels as well. Administration changes in key countries worked in our favor, with the Biden administration introducing the Inflation Reduction Act, which is touted as one of the greatest pieces of sort of global climate policy of all time, and administration change in Brazil was very, very instrumental in hopefully helping to protect the Amazon again after the huge destruction we saw under the previous administration. Right here in Canada, with what's called the Nature COP, COP 15 in 2022, the 30 by 30 agreement was signed to protect 30% of nature and untouched land by 2030. And then finally, most recently at COP28, just last month, we saw for the first time the terminology of fossil fuels being specifically utilized in a major statement as an outcome. So we finally have the formal call for a phase out of fossil fuels to net zero emissions by 2050. And a specific call to triple renewable energy around the world by 2030. So those are certainly not all that it's going to take, but a good step forward. Now let's go from global to local and look at some of the solutions that we need right here in Ontario and things we can advocate for. And really in Ontario, some of the most important things to focus on are energy and land use. So first of all, as all over the world, we need an urgent transition off fossil fuels to clean renewable energy. And that in particular will apply to our electricity grid, which definitely needs to be expanded. And we have a government that's trying to push us in the wrong direction towards gas-fired electricity and nuclear, and we really need to advocate for renewable energy. In terms of land use, we need to redesign and reimagine our cities, communities, and lives to limit sprawl. And I don't need to tell you that we need smaller and self-contained communities and densification within our urban centers. And of course, we've seen the highly publicized controversy over the use of the Greenbelt and reversal of some of those harms that had been recently legislated by the government. To get around our land, we need transportation solutions. We need better public transit with zero emissions and last mile solutions built in to improve uptake. And where private transport must be used, we need to advocate for EVs with the use of bi-directional chargers, because that can play a huge part in reducing emissions from our energy grid. And until we complete the transition off fossil fuels, we need more stringent fuel content and vehicle emission standards. And of course, we need to promote active transport, so cycling and walking, which requires the proper infrastructure to be planned, designed, and built. And we need to increase our green space infrastructure, including urban infrastructure, and also vegetation barriers in areas of high traffic, which actually helps to absorb air pollution. And this is one of the evidence-based recommendations from the Cape Trap Report. Um, uh, I won't dwell too much on this, but of course, a lot of this is brought together in the concept of the 15-minute neighborhood, which you're probably all familiar with. But I think the one thing I wanted to mention here is that when we're advocating for things like this, to remember that these solutions need not be a sacrifice, and that a properly developed community, good land use, in fact, can really enhance our lives and make our lives better in so many ways, rather than end up being a sacrifice. Now, what about the role of advocacy to achieve these goals? If we frame the problem to say that improving human health by urgently mitigating the climate crisis and air pollution is highly cost effective and delivers significant co-benefits in addressing the climate and biodiversity crises that we're also facing, what can we do to work towards these goals? So improving our environment in order to improve human health. It helps to understand different the models of advocacy. So we can think about advocacy at the micro level. So our own individual selves, making change at the level of our families, friends, and neighbors. We could bump it up a little bit to the meso level and try to make change at the level of communities and organizations. And then we can bump it up to the highest level, the macro level, where we seek to influence policy or create systems change. One question that we're often asked is individual change more important or systems change? And really, this seems to be a bit of a false dichotomy. And again, I'd use the analogy of saying really these are two sides of the same coin, rather than conflicting theories. Understanding how individuals function and think, what our habits are, can contribute to climate change, and how we use that to contribute to climate change, can guide advocacy for better policy and systems change at a larger level. We need to remember that ultimately systems are made of people who make daily choices, which ultimately shape those larger systems and policies. And an example, a little story I can share, is in speaking to, I did a series of interviews with somebody very, very high up in the banking system to try to understand the flow of money and what prompts banks to continue to finance fossil fuels. And the interesting thing I heard is that in the past, banks being accountable to their shareholders felt that they needed to, fund fossil fuels to answer to their shareholders. But increasingly, they are getting calls for divestment from their shareholders. Not that we've seen any outcomes, much reduction or action on the end of the banks based on that, but it is starting to register with them. So in terms of individual advocacy, just to sort of list off some of the things that we can all be involved in. So of course, increasing our knowledge base to be aware and educated on the issues as we're all doing tonight, as we sort of come together and talk about these things. But to be involved in, say, signing petitions, action letters, open letters, anything that we can get our hands on that seem to be reasonable. It's great to write, our own material. So op-eds, letters to the editor, articles, writing our own petitions and circulating them, writing reports and doing submissions to government. So there are many opportunities for public consultations, for instance, and those are great to take advantage of. Anyone versed in social media, which is my Achilles heel for sure, it is such a powerful medium to amplify, and in terms of posts, tweets, blogs, and so on, to really reach a lot of people. And to dialogue. So active listening and balanced conversations to try to reach outside our bubble. And this, I think, is an incredibly key point and probably one of the hardest ones to achieve. It's so much easier to be in a group of like-minded people and talk in our echo chamber, but we really make progress if we're able to, to be heard and to listen outside our own bubble. And sharing our knowledge is, of course, important. Civic engagement. So engaging with our elected officials is really, really key. So if you find issues that you're interested in, a simple phone call, an email, and of course, a request for a meeting are incredibly impactful. Templated action letters also of value, but even a simple phone call or just the shortest, simplest email but which you've done personally can really have more impact. Participating in public events, so rallies, marches, demonstrations, of course, volunteering our time to whatever most needs doing. Or if we're strapped for time, even donating just, our financial support, whatever we can give to groups doing good work. And I know for many years in my own life when I was extremely busy training for medical school and so on, and just did not have any time to volunteer, I tried to at least keep up with, supporting wherever I could, to feel like I was doing something. And then of course the huge impact of joining a group. Sometimes I'm asked, if I could just do one thing, what is the most impactful thing? And that's a hard question, but I sometimes say join a group because I think that, again, we can learn so much from each other, and we can amplify our impact. And I think there's the wonderful synergy that we get by the energy and inspiration that we can derive from each other when we're working in a group. And speaking of groups, I'll just finish with this. I wanted to pass on just a couple of key points that I learned while taking a course in sort of climate health organizing and working in groups. And one is the value of one-to-one relationship building, whether it's in person or even virtual. This has really been shown to support some of the best working relationships. Also establishing norms and expectations when we are functioning as a group. And also to remember that leadership really is about enabling others to act and empowering others rather than just leading a flock. And that when we're in a group as well, we can have a little bit more sway with engaging media, whether it's press or social media. And then, of course, groups working with other groups and building coalitions is incredibly powerful, where we synergize strengths and skills and work in cooperation. So I will finish with that and a quote from one of my big inspirations, to say that we really cannot get through a single day without having an impact on the world around us. And then what we do makes a difference. And we will have to decide what kind of difference we want to make. So we want to use our voice and definitely our vote. I think democracy is a huge tool, and our choices to speak truth to power, like our world depends on it, because increasingly it most certainly does. So thank you very much for your attention.
That's great.
Thank you very much, Millie. That was super. I'm going to open this up for questions and answers, and we're going to do it slightly differently this time. We're going to have two options. You can send a chat in the chat box, and Joy will monitor that, and she will read them out to Millie. Or you can use the hand raise symbol, which should be either at the bottom of your screen in a regular computer, or at least on my PC it is, and on an iPad it's at the top. You just click on the bottom or at the top and you will see it. There's a little hand that you raise. If you just put your hand up, I may not see it because there are two screens here that I'd have to scroll through. So if you want to, you have those two choices. You can use the chat box, or you can put your hand up and then I'll ask you to unmute and you can ask the question yourself. Can you use, Elena, can you use the icon? Okay. So unmute yourself, Elena, and I'll get you to ask the question. Unmute yourself, Elena.
Yeah,
Elena.
sorry, Jill, I can't find it because I'm on a different computer. Anyhow,
Okay.
I want to thank you, Mili. This has been amazing, just amazing. A lot of information to absorb, but good to have you. I'm wondering if you people have done a comparative study across Canada. So it would make sense to realize that because we have the largest population in Ontario, we may be the biggest polluters and our air may be the foulest. But I'm wondering, how do we compare across Canada? And is there a province that has much cleaner air outside of living up in the Arctic that we could learn a few things from?
So the answer is probably yes. I don't have sort of, the statistics at my fingertips, but what I can tell you, just working from memory is certainly in terms of the impact on our health from air pollution and the death rates. We definitely have the highest death rates, due to air pollution across the country. And when it comes to the economic impact, nearly half of Canada's impact, so Canada's impact, due to air pollution, and these are 2016 statistics, were about $115 billion, but about 50 billion of that comes from Ontario alone. So that much I can definitely tell you right off the top of my head. I don't know, off the top of my head which province has the cleanest air, but it's certainly not Ontario. So that is a very good question.
Do you
And
have anything in the chat box, Joy?
Oh, I don't see anything yet.
Okay. Well, I have a question. I was interested to hear that antibiotic resistance increases with high levels of pollution and with climate change. How does that happen?
So it's emerging research. So a lot of the mechanisms are still being worked out. One of the mechanisms seems to be an increase in the sort of generational rate of the bacteria reproducing, which of course will allow for more mutations to occur. So that seems to be one such thing. We know that, there's other impacts. So for instance, with the collision of human populations, animal populations, and the environment, so what is often comes together in sort of one health type of studies, we also know that, for instance, when we have more bacteria with antibiotic resistance being dumped into waterways, the genes can actually be transferred to other pathogens, so that other bacteria, other pathogens can wind up demonstrating that antibiotic resistance without ever having been exposed to that particular antibiotic. So the mechanisms may turn out to be very, very complicated, and we're still learning about this.
Interesting. And Leslie, you have your hand up. Would you unmute and ask your question, please?
I was very interested in the same connection that Jill has made. Within my personal health, I have had CLL, or chronic lymphatic leukemia, for 10 years on a straight line of no treatment and no change until this past year. And we had the terrible air pollution in the spring, which affected me, and with asthma and having to have antibiotics for sinus infections. And this fall, the sinus infections have been through the fall and into the winter, and I'm now on antibiotic number 6 to try and bring that under control. And my leukemia has dropped to the point where I now need injections for to give me an immune system at all. And I hadn't put all those pieces together. And I find that just amazing that so many changes could happen in my personal health in a very short time. And we have had more challenges with air quality in our community. So I imagine many people my age will be having experiences like this. And in the leukemia aspect, which areas of leukemia are most affected? Because leukemia has many different branches.
Yes, and that's a great question, and also one that, again, off the top of my head, I can't tell you if there's, any one that is more prevalent than others. And part of that comes from the fact that this research is so difficult to do because, again, there's so many variables. So it becomes very difficult to dissect out. So these are not, these are not things that we're able to do sort of a randomized controlled trial where we can, very rigidly and scientifically take out all the other variables and then come up with that conclusion. They're often being done on sort of with observational statistics where we can clearly see that, populations who have, certain exposures have a much higher incidence of certain diseases, but we're not at the point where we can really break it down, to a lot of granular detail.
Thank you.
But yeah, but it's really powerful to hear about, your own personal experiences and that connection, between health and the environment, because it is so strong.
Mhm.
Do we have any questions in the chat box, Joy?
No, I do not.
Oh, Elena has her hand up again. I can see your hand because you're on my screen.
I found the yellow hand, but I don't know how to get it up into my box. Thanks, Jill.
You just clicked on it.
Okay, well, I tried, but maybe I put it in somebody else's box. Mili, let's just talk about the government support or lack of support for a moment. Are you getting more let's talk federal government support, i.e. monetary support, or do they just pay lip service? Are they half listening? Is it encouraging, or are you kind of banging your heads against the wall? In the provincial, we've got Doug Ford who wants to build another big super highway and eat up all of our green belt, but and our golf courses. But on the other hand, is he providing provincial support?
Right. And do you mean provincial support or federal support for pro-climate type of action?
To support what you people are doing. Yes.
Yeah. Yeah. So basically, starting at the federal level, yes, we at least have a government who is willing to engage and to listen. So from CAPE, we've had multiple meetings with different, MPs. And we played quite a role in, certain federal policies. So for instance, the new Canada Food Guide that came out a few years ago, that reflects actually concepts in planetary health. So for instance, the fact that there's less milk, there's less dairy, advised on a daily basis, that included environmental concerns in the production of milk. In SEPA reform, which is the Canadian Environmental Protection Act, which had not been updated for decades. CAPE played a major role in that, along with, of course, many other, advocacy groups. But the government was willing to listen, and SEPA, for instance, has now been reformed, and it went through some very, very valuable and overdue updates, which can be utilized now to, to fight for environmental protections along the way. When it comes to, and of course, this is not, no government is perfect. We also know there's a lot of greenwashing going on at the federal level as well, but at least they're willing to engage. At the provincial level, it has been very, very difficult to advocate. The two main things that we've been working on have been sort of the Greenbelt issue. And again, we work in coalitions with many, many other groups. And of course, we do know that there has been some movement on that. We have been able to push back on some of what was in that More Homes Built Faster Act, and especially, the violation of the Greenbelt. But it took a lot, and it took a lot of strategizing, trying to persuade the voter base, looking at who votes, who voted in for this party or this government, and can we get those people to see the connection and see the harms, and push, against this. So there was a lot involved in getting even a little bit of reversal. The other thing that we're working on is the energy grid. So we have been systematically deputing against gas plant expansions, jurisdiction by jurisdiction, with a group of about 5 or 6 other sort of organizations. And we've had about a 50% success rate, where we've gotten municipalities to stand up and say no to expansion in their municipalities, and expansions could not go forward without those approvals. But what we had to do essentially to get that was really to bypass the province and go to the municipal level. But that only worked because the province had built in a proviso to say that municipalities would have the sort of a veto power. Although interestingly, apparently that proviso was originally put in thinking it would be utilized to veto wind farms when they first came into power. So I don't know if that answers your question, but
Thank you.
I have a few things in the chat box now. Wendy asks, have studies been done on how effective electric cars will be in reduction of noise pollution, particularly living in urban environments?
Yeah, that a lot of great questions tonight. So that is definitely a fantastic question. I'm not aware of studies, but certainly we anticipate that there will be a reduction in noise pollution. What I can tell you is that there are actually health impacts of noise pollution. So if anybody wants to, take a peek later on at that TRAP report I mentioned, the traffic-related air pollution report by CAPE, we actually document a lot of the health impacts of noise pollution. But I can't, again, off the top of my head, quote you a study on noise pollution. But it's certainly worth studying, and we certainly believe it's going to improve.
So have there been any cost benefit analysis as regard to electric cars?
Well, there certainly are cost benefit analyses in terms of fuel costs, and costs to the environment in terms of emissions reductions, and then of course emissions reductions translating into public health benefits. Now again, I can't think of one that sort of links all three, but we know that various studies certainly link all of those different issues. When we talk about the economic sort of co-benefits of reducing fossil fuels, not only are we talking about the direct impact of just reducing the burden of human health impacts, adverse impacts, but of course the cost of caring for all those people, and the fact that pollution or fossil fuel induced climate change actually has negative impacts on healthcare delivery. So we know, for instance, with extreme weather events, that it increases the risk of things like power outages, evacuations in health centers, or even closure, disruptions in the workforce. It increases the cost of delivering healthcare, and it also diverts potential healthcare funding away to other climate induced costs, which are often massive. So there's, again, so many complex interconnections there, but many of which, wind up with huge cost benefits.
Has your group been involved with Stop the Sprawl? That they have, it's shown that this group has focused on the impact of resistance. Okay, I'm not sure. Well, I guess the point being that it's very important for individuals to take action.
Yes.
Perhaps I can speak to that a little bit. It's about what Millie said, that individual actions do count, and the Ontario government has been, you've probably heard about the green space being encroached upon and selling off land to developers and all the rest of it. A group of citizens formed a group called Stop the Sprawl, and they have been very effective in bringing pressure to the government to withdraw a lot of those agreements. So the point of this being, and they've communicated largely through social media. So things that Millie said about social media being powerful, individual action being powerful, they do count. And as she said, it's easy for us just to be in our own bubble and say, I'm so small, I can't do anything. But if you do nothing, nothing will change. So it's important to take a step wherever we can. That's what I was trying to get across.
Yeah, absolutely, Mary. I definitely agree with that. I was speaking to a good friend of mine who was visiting from the US over the holidays, who was feeling very hopeless about, where the, their federal politics are going, and with the election looming. And she just kind of said, I don't feel like I can do anything about it. And we were talking about that. I said, look, any little thing, if you contribute a little bit of money, make a donation to independent journalism, and you've done something. That everyone can find a little way to do something, even if the problem seems huge. So yeah, absolutely.
Yeah, thanks for that, Millie.
So Elena, you have lots of questions tonight.
I will only ask one more, only this question. All right. You alluded to the Montreal Agreement of December the 22nd, that by 2030, 30% of nature would be protected. Now, this, I presume, is a federal statement. Okay, they just gathered in Montreal. But is it simply an umbrella statement? Is it specific? Is it very specific? If I went online to call it up, could I find out everything that they're doing, that the provinces are supposed to be doing to meet the 2030 percentage?
So I don't know how much you would find in terms of what provinces are doing right now, but you would certainly find information about the agreement, because this was an international agreement. So Canada's part of it, of course, yes, is made by the federal government. So you may find something more, on the federal government's website, but it was an international agreement. And I think, it's been well understood for a long time that the general formula was that we should be trying to conserve, 30% of our untouched land by 2030. But this was the first time in history that it was put in writing as a pact, and countries signed on internationally.
Okay. Thank
It's
you.
my understanding that Canada has done, they are in the process of protecting more of our lands across the country.
Yeah. As I say, that formula has long been sort of accepted as the target, but this just really formalized it for the first time, and got other countries to agree as well.
So we have one more hand raised, and I think that should be our last question, unless somebody has something really burning that they have to ask. Jolene, would you ask your question?
This sort of ties into what we were just saying. There's more emphasis on stopping sprawl and building up in cities, and encouraging more people to live downtown, as it were, et cetera, et cetera. When you're encouraging people to do that, are you also taking into account that people need green space within the city? And in Ottawa in particular right now, I'm thinking about the two high-rise towers they're building around the experimental farm, which is going to impact on that farm. Now, as an experimental farm, maybe we don't need it, but as a green space in the middle of the city, we certainly need that green space because of what it generates in terms of green air, if you want to put it that way. How can you make the two go hand in hand? It's okay to increase the number of people living in a city, but we really, really need green space within the city to keep everybody healthy. Is that going together?
Yes, no, absolutely. That's a very apt question. And again, obviously, I'm not an urban planner, but it's something that we look at quite a bit at CAPE. And essentially, when urban planning is done well, the entire point of densifying in certain areas, and I didn't dwell too much on that 15-minute neighborhood graphic that I had, but what it shows, of course, is the rationale to densify in small footprints is specifically in order to preserve land for urban green spaces, so that everyone can make use of it. And at CAPE, we actually have a program called the Parks RX program, or PARX, and it's based on the fact the idea is to try to get doctors to prescribe time outdoors and time in nature to patients. And it sounds very simple, but it's based on the science that shows that, for instance, seniors who live near green spaces tend to live longer and have better health. Kids with ADHD who spend more time out in nature can actually reduce their ADHD meds, improve their memories, do better on school testing. So there's a lot of evidence that shows the benefits of that. So we advocate for that type of land use based on public health. The other part of the puzzle in terms of what urban planners have been suggesting, you're right that at the end of the day as well, there's only so much density you can put into a small footprint, in downtown in a city. One of the other approaches is what's called gentle densification in the suburbs, where land is already developed, so not out in a farmer's field, but where the homes are large and spread out. Right in my own constituency where I live, my municipal councillor actually put forward a proposal to allow fourplexes throughout the city. And of course, unfortunately, there was no pre-education done. The council was not progressive, not ready for this, and it was, soundly voted down. But it was an excellent proposal. That's what urban planners suggest, so that taking land that's already developed, but not maximally utilized, that's where we want to add density.
Okay, thanks.
Thank you very much. I'll pass it over to Sandy. Sandy, would you?
Yes, Dr. Roy, thank you very much for coming, for presenting all this information. It's a lot. And thank you too for the work that you're doing on our behalf through CAPE and your other organizations. I learned a lot tonight, in particular the links to our health, different, even how pollution even affects our endocrine system, our blood, how it's affecting the effectiveness of antibiotics, and how COVID is somehow acting as a messenger to bring the small particles into the blood system. That's quite alarming, actually. Thank you too for the encouragement that the progress that we're making with wind and solar power. I don't know why we're not doing more with that, and why we're going to these nuclear power generation plants. I can't see how they can justify that. But anyway, it's easy to feel overwhelmed by the rapidity of climate change and the magnitude of everything that's happening. And thank you for encouraging us to do something, to try and make a difference ourselves, to join a group. Certainly in a group, you're more powerful, and you can encourage each other. And it's the final question which struck me was, what kind of a difference are we going to make? You have to start somewhere, so let's start. And I'll just mention that you're donating your honorarium to CAPE, the Canadian Association of Physicians for the Environment, which seems to me, I didn't know anything about it before, but seems like a wonderful organization. And thank you very much for sharing all this with us tonight.
Thank you all so much for giving your